I'm just going to divert a bit and talk about the COVID numbers. And there is a big spike which has happened, at least in Maharashtra. And how should one really read into it? Is it fear of just a second wave coming back? Is this something which we need to worry about? Why has suddenly the numbers in Maharashtra gone higher? Dr. Rahul Pandit from Fortis Hospital joins now. Dr. Pandit, good afternoon. Thank you for joining us. Why has there been a sudden spike in the state of Maharashtra and COVID numbers?
I think a very important question, which all of us want to really know the real reason, but I think there are several reasons behind that. We can't see it point out to one reason. Let's take the case of Mumbai first. Mumbai has seen around 20%, 25% rise in the last 4 or 5 days. We were down below 400 cases. Now we reported 645 yesterday. And I think the reason which I could easily say is one is that people are not really adhering to the corona appropriate behavior, which is masking, social distancing, and sanitization. Secondly, the locals must have contributed. Opening up of local for all general population must have contributed to a little bit of spike. And the third thing which I'm sort of seeing is the population which is getting admitted to my hospital right now. And the patients which I'm seeing right now are the patients between 60 to 80 years of age. And those are the people, I believe, who were extremely cautious during the last 9-10 months of pandemic. We're not venturing out of home. But now with everything opening up, they have also ventured out of home for obviously some good reason for which they had to go out. It's not practically possible to be homebound for 9-10 months. And I think they are unfortunately getting the infection and then they are falling sick. So I think these would be 2 or 3 things which I think have contributed to the numbers in Mumbai. Rest of the Maharashtra, I think we need to do the testing, tracing, and treatment part quite aggressively. Behind every one positive patient in the rest of the districts, we need to at least try and find out between 15 to 20 contacts and test them and basically isolate them if required. And I think these are some of the reasons why we are probably seeing the rise in the numbers in the last few weeks.
Is it any kind of a virus mutation which has come, or this is the old virus which because of carelessness is spreading again?
Two things which are very obviously seen again are that the virulence has not changed. We are not seeing suddenly very severe patients. We are seeing patients from one family, and they are sort of coming positive. And I've got at least 2 or 3 families in the last 3-4 days where 6-7 members of the families have fallen sick, and all of the families reported one single big event in the family which happened, either a wedding or a birthday or some get together. So I think the carelessness is actually paramount. That is what is causing all of these problems. And if we can be a little bit more careful, be a bit more vigilant, and have some responsibility of being corona appropriate behavior, we probably would be able to bring down the cases again. I don't see any other reason why we should not be, coming down with the numbers if we go back to our corona appropriate behavior, what we were 4 or 5 months ago.
Dr. Pandit, I want to go back to the whole vaccination bit. Currently, we are in phase 1, which is that the healthcare workers are being vaccinated. Now, isn't it quite ironical that when vaccination drive in India started, even though it's a very restricted vaccination drive, the virus numbers are also making a comeback? And also, do you think now hospitals like Fortis are prepared now to move to the next next phase of vaccination drive?
So at least in Maharashtra, in Mumbai, beg your pardon, we haven't opened up vaccination in any of the private hospitals. So it is still pretty much done by the Bombay Municipal Corporation through their outlets or their hospitals. But yes, hospitals like Fortis and other private hospitals are very much capable and would be very keen to join hands. Just like we joined hands in treating COVID, we would be very happy to join hands to sort of be a part of the vaccination program. Coming to your first question, that it's ironic that we are seeing a rise in the number when the vaccination drive has been pushed in. Remember, the vaccination drive is still for the frontline workers. I am not seeing a lot of frontline workers coming and being my patients right now. What I am seeing is the elderly with the comorbidities. And I think once we enter the second phase, which is the 27 crore people who are above the 50 years of age and who have comorbidities. Once they start getting vaccinated and we at least finish one dose of vaccine in them, I think the numbers will come down. And why have the numbers gone up now? Obviously, when there is a vaccination program being rolled out, there is a sense of relief in the whole society. And again, I come back to the same thing. It might be sounding repetitive, but people become a little bit more casual and drop their guard down. Once the guard is down, that's where the corona hits. Corona is not gone anywhere, my friends. It is very much there, waiting for an opportunity to come back. And I think it's in our hands not allow it to come back with the vengeance. Otherwise, we'll be looking at another peak, which will be very difficult for us to handle.
Dr. Pandit, you spoke of patients over the age of about 50, 60 who have been catching the virus right now. I just wanted to understand what is the extent of how much the disease has or the virus has impacted them. Is it usually by and large mild cases, or are we seeing it hitting people fairly severely? And what do you think it would be the reason that you would attribute to either scenario?
Look, majority of them, fortunately, are mild cases, asymptomatic or mild cases. So one member in the family is getting positive, and then the other elderly person who is staying in the family is also found to be positive at times. I have a fair number of patients whom we are looking on as the outpatients, whom we are managing at home quarantine right now. And they are all between the 60 and 80 years of age. Also, admissions. I think almost 60% of my inpatients right now are mild to moderate illness with that age group. And I think the only reason why I can attribute this is that they have ventured out after a long time, thinking that the cases have gone down and it is now probably a bit more safer for them to go out. Secondly, everybody else in the house, which are the younger group of people, are also going in and out of the house now more frequently. And they might be by chance bringing back infection, which the old elderly are catching and which probably the young are now immune to, or they may be completely asymptomatic. So this is the reason why we are seeing this little elderly population, 60 to 80 age group of patients, which are coming to us more. But apart from the fact that they are getting infected, the good thing is that most of them are mild. We are not increasing a virulence increase as such.
Thank you so much, Doctor, for joining in and giving us a view as to what exactly this next spread of coronavirus that we're seeing in Maharashtra, especially as well as Kerala, mean, and what exactly people should be doing at this point in time. So as Dr. Rahul Pandit said, it is very much in the air still, and one needs to be vigilant and make sure that the spread does not escalate, because we as a country will not be able to handle a second wave.